We place our lives in their hands. We trust them with our most vulnerable moments. We trust the standard of care, the bedrock of modern medicine, to be sound, based on facts, and guided by science. But what if that trust, at least historically, is misplaced? Imagine facing a terrifying cancer surgery that leaves you disfigured, only to find out it was entirely unnecessary. Imagine taking a pill prescribed during your pregnancy, believing that it protects your child, only to discover, decades later, that it gave them cancer. This is the terrifying reality of medical reversal. It's not about minor advancements or tweaks to treatment. It is about the fundamental undoing of long-held, universally accepted practices because they were proven ineffective, useless, or in the worst cases, deadly. We're going to explore the darkest chapters in medical history, from the horrors of the lobotomy winning a Nobel Prize to the miracle drug that poisoned a generation. These stories expose a profound truth. Medicine is messy, and medical certainty is nothing but an illusion. How did intelligent, well-meaning people get it so wrong for so long? And what does this history of errors tell us about the treatments and the nutritional advice that we accept today? Join me as we discuss the Age of Error, right here on the Carnivore Science Channel. The core concept and mechanistic bias. Historically, the common pattern was rarely malice. The doctors weren't evil, they were simply working with limited data. The true culprit is mechanistic bias. This is the assumption that because a treatment makes sense on paper, and because the proposed biological mechanism is plausible, it must work in the complex human body. For much of medical history, if a respected authority claimed that a theory was sound, it became fact. This began to change with the mid-20th century with the rise of evidence-based medicine, or EBM, which demands larger, randomized clinical trials. EBM acts as the relentless fact checker, and when it finally runs the numbers, it often reveals that the plausible theory was actually fatal nonsense. We're going to examine 4 major examples of this failure, starting with a deeply rooted prejudice. Hysteria and the wandering womb. For thousands of years, the female reproductive system was not viewed as just another organ, but as an unstable, independent entity. Beliefs traced back to ancient Egypt and the philosopher Plato held that a woman's uterus was a restless animal that became angry and moved throughout her body when a woman was unmarried or childless.
Wait, what? They got what?
By the 19th century, this evolved into the diagnosis of hysteria. It became a clinical catch-all for any woman who exhibited traits that conflicted with Victorian social norms, like anxiety, independence, a lack of interest in domestic life, or simply strong emotions. The established medical treatment to calm the nervous woman was often bed rest, bland diet, or infamously the pelvic massage, a procedure that doctors believed was medically necessary to induce a hysterical paroxysm. This diagnosis served as a powerful tool for social control, labeling outspoken women as fundamentally ill. The reversal was slow, spanning decades of growing anatomical and psychological understanding, but the sexism was so deeply ingrained that hysteria remained a formal mental disorder in the American Psychiatric Association's manual until 1952. It was not completely removed from the diagnostic manual until 1980. Crazy, yeah? The myth of the local disease and radical mastectomy. For nearly a century, from the 1890s to the 1970s, breast cancer patients faced a brutal disfiguring surgery that was considered their only hope. This was the Halsted Radical Mastectomy, HRM. The man behind it, Dr. William Halsted, operated on a compelling but ultimately flawed mechanistic theory. Cancer was a localized disease that spread outward like a wave. His logic dictated that to save the patient, the surgeon must remove everything in the path of that wave. The surgery was devastating. It removed the entire breast, all of the lymph nodes in the armpit, and the underlying chest wall muscles. It left women severely disfigured, often with limited arm movement, yet the surgical community refused to question its effectiveness. Questioning the HRM was considered a betrayal of the standard of care. The reversal came from the work of Dr. Bernard Fisher. Fisher theorized that cancer was often a systemic disease from the start, meaning tiny cancerous cells had already spread throughout the body, making the removal of extra muscle and tissue pointless. Starting in the 1960s and 70s, Fisher ran large, prospective, randomized clinical trials. This was the power of EBM at work. The data provided, beyond a doubt, that radical mastectomy offered zero survival advantage over less invasive surgeries combined with radiation therapy. The cruel standard of care was abandoned by the early 1980s, all thanks to one doctor who trusted the data, not the surgical dogma. The lobotomy, the prize-winning tragedy. Out of the desperation of overcrowded mid-20th century asylums came a promise of a cure for severe mental illness. This promise was the lobotomy. Its inventor, Egas Moniz, hypothesized that by severing the frontal lobe's connections, you could disrupt destructive, repetitive thought patterns. For this, Moniz was awarded the Nobel Prize in Medicine in 1949. But the procedure's true evangelist was the American neurologist Dr. Walter Freeman. He simplified the surgery into a chilling transorbital or ice pick lobotomy. Freeman made the process tragically fast. Using a thin instrument, he would hammer it through the thin bone above the patient's eyeball and sweep it back and forth to destroy the neural pathways. The procedure could be done in 10 minutes per eye. Freeman traveled the country in his lobotomobile, not kidding, performing over 3,500 lobotomies. The human cost was staggering. Victims like Rosemary Kennedy, sister to John F. Kennedy, were left permanently incapacitated. The lobotomy was designed to make patients quieter and compliant, but it did so by robbing them of their personality, their emotions, and their very selfhood. The reversal was not judicial. It was chemical. The introduction of the first effective antipsychotic drugs like Thorazine in the mid-1950s provided a viable, less destructive alternative. The practice quickly became obsolete and was banned or abandoned globally, leaving the Nobel Prize as a stark, permanent symbol of a medical error. For over 30 years, millions of pregnant women were prescribed a simple pill that promised a medical miracle: DES, or diethylstilbestrol. DES was a synthetic estrogen, and from 1940 to 1971, doctors worldwide were convinced that it was a necessary prophylactic. They sincerely believed that DES prevented miscarriages, reduced complications, and led to healthier babies. The evidence was weak, but the mechanistic bias held that hormones must be beneficial for a successful pregnancy. This drug was so common that it became a routine part of prenatal care, affecting an estimated 5 to 10 million pregnancies in the United States alone. The reversal came in 1971 with a discovery that terrified the medical world. Researchers identified a rare form of vaginal cancer, a clear cell adenocarcinoma, occurring in an unprecedented number of young women. The common link between these women was that their mothers had all taken DES during pregnancy. Not only had DES failed to prevent miscarriages, but the drug had acted as a powerful teratogen, a substance that disturbs the development of an embryo or a fetus with a latency period of 2 decades. These daughters, known as DES daughters, face not only a rare cancer, but also increased rates of infertility, abnormal pregnancies, and other serious reproductive tract anomalies. The legacy of DES is intergenerational harm. It has been called the silent thalidomide because, while less immediate than the thalidomide tragedy, the consequences have extended to the daughters of the women who took it, and the medical community continues to monitor potential effects in the grandchildren, the DES grandchildren, today. This reversal taught medicine a painful lesson about the long-term delayed consequences of systemic drugs on fetal development. Dogma disproved: ulcers and antibiotics. Before the 1980s, if you had a stomach ulcer, the diagnosis was absolute. It was caused by stress, spicy food, and an overproduction of acid. The mechanical logic was sound. Acid burns, so stress must be causing too much acid. The treatment was lifelong acid blockers, bland diets, and stress reduction. But 2 Australian doctors, Barry Marshall and Robin Warren, challenged this certainty. They discovered a spiral bacterium, H. pylori, in the stomachs of ulcer patients. The medical establishment scoffed. Dogma held that bacteria could not survive the harsh environment of the stomach. How could these 2 unknown researchers possibly be right when decades of esteemed gastroenterologists had agreed on the stress theory? Facing massive institutional skepticism, Dr. Marshall took the ultimate scientific risk. In 1984, he famously drank a beaker of the H. pylori culture. Within days, he developed gastritis, the precursor to an ulcer. He then cured himself with a simple course of antibiotics. He had proven his theory on his own body. This single act led to a reversal of an entire field of medicine. The treatment for ulcers changed from years of dietary management to a simple 2-week course of antibiotics. Marshall and Warren were finally awarded the Nobel Prize in 2005. Conclusion: the forever lesson. The history of medical reversal is not just a history of failure, but it's a history of learning, a brutal, often painful self-correction. It teaches us that medical certainty is actually an illusion. The standard of care is a living, breathing document, constantly being questioned by the cold, hard logic of the evidence. The lesson for us today is to embrace informed skepticism. We must not accept a treatment just because that's how it's always been done. We must ask, what is the evidence? And this approach is not just limited to disease treatments, but also to what you're told to eat by the nutritional experts and the medical industrial complex. So the next time that you hear your doctor rattle off how animal fats cause heart disease or red meat causes cancer, remember this: the only constant in medicine is change. The only certainty is that some practice universally accepted today will inevitably be reversed tomorrow. So which of these reversals shocked you the most? Have you or another family member ever experienced any of these reversals yourself? If you have, let me know in the comments section. And how do you think that this relates to the nutrition space? I think it's very relevant personally. But let me know what you think. I'll be interested to hear it. And if you like this video, if you could hit the like button, it really helps out and I would really appreciate it. And please subscribe so that you don't miss out on future videos and live streams. And I'll see you guys in the next video. Bye.